So even though we focus at the top part of the neck, one thing we get a lot of is low back pain, sciatica pain, hip, knee pain, and that hasn't responded to other types of treatment. And the reason that we get it and the reason that we do so well with it is kind of the way our body functions. So if one of these top bones misalign, let's say it goes out to the right like this, it's going to make my head tip a little bit. So that bone gets stuck out of place and your body can't unstick it. So what happens is the rest of the spine and the body have to twist and turn and change to compensate for that head being off. There's a reflex that kicks in. So once that kicks in, I can't straighten my head, so now the rest of the body's going to move. So I tend to drop a shoulder a little bit, a hip will come up, it'll kind of twist and rotate. And we see that here, when the head comes off, the shoulder drops, the hip comes up, and the rest of the body's got to compensate for the head being off level. And when that happens, we're going to kind of get an imbalance of muscles from one side to the other. Maybe one side is more spastic and tight as it tries to straighten out. That puts pressure on the low back, those muscles spasm up, and we get low back pain. So if we do that, maybe we see a compensatory misalignment somewhere here in the lower back, but no matter how many times we might try to adjust that or stretch it or whatever it is we may do, if we don't remove that initial problem, that initial compensation that caused the body to shift out of position, we're not going to get rid of the problem down there. So once we correct that, the head's back on level, the rest of the spine will unwind itself and straighten out, and the low back pain goes away, or the sciatica, or the knee pain, or whatever it may be that we were getting from that imbalance.